Hello there. Welcome to The Forgotten Trimester, a YouTube channel dedicated to the education, encouragement, and empowerment of people about the fourth trimester. I am Dr. Megan Gray. I am a board-certified practicing OBGYN and mom of two littles. On this episode, I want to touch base on postpartum depression. You will learn what postpartum depression is. You will learn about the signs and symptoms of postpartum depression. You will learn some of the common treatments for postpartum depression and who you need to reach out to if you feel like you may have postpartum depression. So let's get started. So postpartum depression is one of the most common postpartum mood disorders. It usually occurs after birth, and it is, however, the symptoms can start during pregnancy and just become noticeable after birth. It is incredibly common. About 1 in 10 women will have signs and symptoms of postpartum depression, maybe even more. It does tend to go undiagnosed. So if you line up 10 of your friends, that means at the very least, one will have signs and symptoms of postpartum depression. So it's very important to understand what these signs and symptoms look like. So several of the signs and symptoms associated with postpartum depression can occur just as a normal process of the postpartum period. So most women are fatigued in the postpartum period. That is a sign and symptom of postpartum depression, but not everybody that has fatigue is going to have postpartum depression. Difficulty falling and staying asleep. Weight changes. Those three are commonly experienced in the postpartum period, and they don't necessarily mean that you have postpartum depression. But if you are experiencing these three things and they are worrisome, you certainly should seek help. The other signs and symptoms associated with postpartum depression are not associated with the normal experience in the postpartum period. Those include loss of interest in pleasurable things. So I used to love to do X, Y, and Z. Now I could care less. Or feelings of worthlessness, like my life is not worth it, none of this is worth it, I really just don't know what I'm doing or why I'm here. 3, overwhelming guilt. 4, feelings of sadness, emptiness, hopelessness. Those are all common signs and symptoms of postpartum depression. 5, agitation and anger. That rage, the just overwhelming, bubbling over anger. 6, difficulty concentrating, so having trouble completing tasks. 7, and this is very serious, thoughts of death or suicide. So if you are having these signs and symptoms, who can you reach out to? Well, the most common people that you reach out to would be your medical team. So that would include your OBGYN physician, your midwife, your pediatrician, or a psychiatrist if you have one. It is very important that if you are having any of these signs or symptoms, that you reach out to one of these folks. They are going to be the people that can coordinate care for you. Other resources for help would be therapists like psychologists, licensed mental health therapists, and licensed clinical social workers. There are also online resources that have combination of the resources we just discussed. And this online resource is called Postpartum Support International. If you Google it, you can find it. But once again, if you're having signs and symptoms of postpartum depression, do not sit at home waiting, thinking that it's going to go away. Postpartum depression requires management. So if you're having the symptoms, please reach out to your frontline people, which would be your OBGYN physician or your midwife or your pediatrician or your psychiatrist. They will help coordinate care so that you can process what's going on and you will be feeling better in no time. What are the common treatments of postpartum depression? So there is therapy. which the therapists, like the psychologist, the licensed mental health counselor, or their licensed mental social worker, or the psychiatrist will engage. So there's several different types of therapy. One is talk therapy, there's cognitive behavioral therapy, there's group therapy, there's art therapy, there's music therapy, all kinds of different therapies, and your therapist will help identify the best therapy for your condition. Then on the other hand, there are medications. The most commonly used medications are for depression are SSRIs, SNRIs, and Wellbutrin. Some of these medications have been used in breastfeeding, so do not allow breastfeeding to be the reason why A, you don't seek care if you are having signs and symptoms, or B, get treatment for your condition. So I hope all this information was good and easily understood. I really thank you for tuning in. If you love the content, please give me a thumbs up and subscribe to the channel. If you have any questions, certainly leave them down below. I'll be glad to answer anything. If you are not already following me on Instagram or Facebook, please check me out there at Forgotten Trimester. Of course, if you are ready and wanting more in-depth education and support for your postpartum journey, please check out my online course, RX Postpartum, or come work with me one-on-one. Hope you have a great day. Thanks for tuning in. See you soon.